Want to bring in Republican Congressman Rodney Davis of Illinois. Congressman, good to have you here. I've been wanting to talk about health care, but unfortunately we do get a little derailed by the president's tweets. You're a Republican. Many Republicans have come out and issued some sort of statement about whether it's inappropriate or undignified or just unseemly. What's your take on the president's tweet?
I think it's completely inappropriate. I'm disappointed by it. And I think, you know, the fact that I came on here to talk about health care, to talk about an issue that the president and many of us had talked about, the many failures of the existing health care system. 60 million people with no insurance right now, can't afford to use the insurance we have. And it's tweets like this that get all the attention, and it causes a distraction in the legislative process. And that's what stops any agenda from moving forward. Good legislation solving America's problems from moving forward, and I would hope that the administration thinks about that next time. All
right, so let's at least bring it back on track for a few minutes and talk about this. You are a member of the House of Representatives. There is a pretty good chance, one doesn't really know, but there's a good chance this bill doesn't get done, and a number of Republican senators have said if it doesn't get done by this weekend and it doesn't go to the CBO for scoring and voting next week, it may be time to go back to the drawing board and involve Democrats in the process of drawing up the bill. Senate Republicans didn't even involve Senate Republicans in the drawing up of this bill. It was done by a small group of senators. Are you open to a more open process to get a better bill out there?
Oh, I think bipartisanship is the way to solve our problems. I can't really speak for the Senate, but what I can tell you about in the debates in the House when we passed our version of health care reform, the Democrats talked about wanting to work together, but they didn't show up. They didn't want to work with us. Their silence defended the status quo, and the status quo was clearly broken. I would love to have much more bipartisanship. Let's get rid of this harsh rhetoric that we see, this vitriol that we see coming not only from the legislative branch, the executive branch, but also the media and on social media. Let's work together, send a message that bipartisanship is going to actually solve America's problems.
Okay, so here's the issue. I want to just play you a piece of sound from Senator Collins of Maine about what her issue is with the Senate bill, and I want to ask you about that because this part of it is not dissimilar to the House bill. Let's hear this.
From my perspective, the bill needs a lot more than tweaking or tinkering around the edges. It needs a major overhaul so that we no longer would have 22 million people losing their insurance, sweeping cuts in the Medicaid program, which helps our most vulnerable citizens.
So fundamentally, and I've been trying to get to the bottom of this, a lot of Democrats don't want to work with Republicans because they say Republicans are obsessed with repealing Obamacare. But fundamentally, the issue is that there are going to be 22 or 23 million people, whichever bill you're looking at, by 2026 who wouldn't have insurance compared with Obamacare. And insurance premiums will be up by less than they would be under Obamacare. But I've been hearing people telling me that insurance premiums are going to be down, and that's kind of misinformation. By 2026, under Obamacare, they would have gone up by 5.5% a year. Under the BCRA, that's the Senate Trump Care bill, it'll be up by 4.4% a year. So you can see why Democrats don't want to sort of be at the other end of the stick, where you pull back Obamacare and all these people get off of Medicaid, and insurance premiums still go up.
Well, the CBO clearly says that they believe that people are going to lose insurance. Many of those folks are going to choose not to purchase insurance, just like 29 million people right now are not purchasing insurance, even though the law requires them to.
But, sir, you know that they're under 10 million people on the individual market, right? So only
it's about 7%.
But only 11 million people in total could choose not to purchase insurance. So the idea that 23 million people will be uninsured compared to existing law means that it's more than just people on individual policies, right? It actually means Medicaid people won't be insured.
Remember that our plan is a three-phase approach. Remember our House bill that we wrote. I can't speak for the Senate bill. What I can do is talk to you about our bill. It's a three-phase approach. We had to write a bill because of the antiquated Senate reconciliation process. Now, what we did in the House, we put together a bill that we believe is going to actually provide opportunities to get more coverage, better coverage, more affordable coverage for every single American. And that means getting phase 2 and phase 3 of our plan into place. Allow groups like AARP AARP to band together nationwide to create large groups so that their customers, their members, can get access to coverage through groups like that. That's in phase 3. We've talked about this since day one. Now, what we have to do is we've got to address a problem with the Medicaid expansion system in this country, where you have states like my home state of Illinois, where 44% of all the Medicaid expansion recipients are able-bodied adults ages 19 to 34. We need to get them off of Medicaid and into the employer-based health care system, because if we don't, the system we know that helps those who truly need it the most, the aged and disabled, we have to be able to have them make that system stronger, or states aren't going to be able to afford to cover their share of Medicaid's expenses. That's what we try to do in the House bill, and that's what we hope to do to fix the broken system we have.
Yeah, I'm just not sure it gets there. And if you need Democratic support, which it looks like ultimately we're going to need to, we may have to take a different approach to this. But I appreciate the time you've taken to talk to me about it, sir. Congressman Rodney Davis, Republican from Illinois. I look forward to talking to you again.
Thank you.
All right.